There's a $2 bottle in the cooking oil section of nearly every grocery store that can permanently reverse arterial plaque formation. It does not simply manage the condition with daily medication, nor temporarily improve cholesterol numbers while the underlying damage persists. It targets the oxidative stress and chronic inflammation that form the plaque-clogging arteries. At the endothelial level, just 2 tablespoons a day trigger the biological processes that have been narrowing arteries silently for decades to begin reversing themselves. Hippocrates, known as the father of Western medicine, documented this substance as a heart remedy 2,400 years ago. Mediterranean populations, consuming it daily for 4,000 years, show the lowest rates of cardiovascular disease ever recorded. The landmark Predimed trial, one of the largest nutritional intervention studies in history, involving 7,447 participants, demonstrated that daily consumption reduced major cardiovascular events by 30% compared to a low-fat diet. 30% improvement from a $2 bottle of extra virgin olive oil. The global cardiovascular industry generates over $200 billion annually. Statins, blood pressure medications, anticoagulants, stents, bypass surgery, and cardiac rehabilitation programs mainly address the consequences of arterial plaque without correcting the oxidative stress and inflammation that cause it. A $2 daily remedy reversing the biological mechanisms behind arterial blockage threatens every statin prescription, every stent procedure, and every cardiac intervention. Research did not stop due to lack of evidence. The evidence is overwhelming. Public discussion ceased because a $2 bottle cannot produce $200 billion in revenue. The story of extra virgin olive oil, a 4,000-year-old artery-clearing remedy, has been minimized by the industry for decades. Its effects begin in the Mediterranean basin around 4000 BC. Early agricultural civilizations in what is now Syria, Palestine, and the Greek islands discovered that the fruit of the Olea europaea tree produces an oil unlike any other. Olive trees themselves can live for thousands of years, with some documented at over 2,000 years old today. Olive oil was recognized as more than food. Egyptian medical papyri from 1500 BC reference olive oil in wound healing, inflammation reduction, and internal medicine. In ancient Greece, cardiovascular observations accumulated with systematic care. Hippocrates, in the 5th century BC, described olive oil as the great healer, noting that populations consuming it in large amounts experienced less chest pain, breathlessness, and sudden death. Roman physicians extended these observations, with Galen documenting olive oil's effects on the heart and blood vessels. Roman military physicians observed that soldiers from olive oil-consuming regions had better cardiovascular endurance than those from northern areas dominated by animal fat. During the Islamic Golden Age, physicians combined Greek, Roman, and Arabic medical knowledge to produce detailed pharmacological sections on olive oil. Ibn Sina's Canon of Medicine dedicated sections to its effects on the heart, circulation, and arterial hardening. Cardiovascular benefits of olive oil were consistently observed over 2,000 years, becoming an established fact. In the mid-20th century, Minnesota physiologist Ansel Keys made observations transforming nutritional medicine. He analyzed cardiovascular mortality data from multiple countries and noticed that Mediterranean countries, Greece, Italy, Spain, had dramatically lower cardiovascular disease rates than Northern Europe and the United States. He called this the Mediterranean paradox. Despite high-fat diets, cardiovascular disease rates were far lower than in Americans on low-fat diets. The distinguishing factor was olive oil. Keys published his 7-country study in 1970, one of the most cited nutritional studies, initiating decades of research confirming Hippocrates' ancient observations. At the same time, the pharmaceutical statin industry began influencing how cardiovascular research was framed, funded, and communicated for the next 5 decades. Extra virgin olive oil permanently reverses arterial plaque formation, while statins address only a single symptom. Arterial plaque is not merely fat accumulating inside artery walls. Plaque formation begins with endothelial dysfunction. The endothelium, a single-cell thick lining of arteries, actively regulates blood flow, inflammation, clotting, and immune cell activity. Healthy endothelium produces nitric oxide, relaxing arteries, maintaining blood pressure, preventing platelets from sticking, and keeping immune cells from accumulating in the arterial wall. When damaged by oxidized LDL cholesterol, chronic inflammation, high blood pressure, or smoking, the endothelium produces less nitric oxide. Arteries become inflamed. Immune cells called macrophages move into the arterial wall, engulf oxidized LDL particles, and form foam cells. These foam cells accumulate, die, and their contents, oxidized fat, cellular debris, and calcium, form the core of arterial plaque. As plaque grows, arteries narrow, blood flow becomes restricted. Statins work by lowering LDL cholesterol production in the liver. They target one input in a complex process, reducing LDL circulating in the bloodstream. Yet they do not fix endothelial dysfunction. They do not remove the oxidative stress that oxidizes LDL. They do not lower the chronic inflammation that draws macrophages into arterial walls. They do not restore nitric oxide production. Lowering LDL in a system still marked by oxidative stress and endothelial dysfunction slows plaque growth but does not stop it. Extra virgin olive oil addresses the entire cascade at once. Its main active compounds, oleoanthol, oleuropein, hydroxytyrosol, and oleic acid, perform 4 simultaneous mechanisms that reverse arterial plaque formation. Oleoanthol acts as a natural QX inhibitor. It blocks the same inflammatory enzymes as ibuprofen. Researchers at the Manel Chemical Senses Center discovered fresh extra virgin olive oil caused the same throat irritation as ibuprofen. The sensation comes from oleoanthol targeting the same biological pathway. Oleoanthol reduces chronic arterial inflammation, preventing macrophages from entering the arterial wall. No macrophages means no foam cells. No foam cells means no plaque core. Hydroxytyrosol is one of the most powerful natural antioxidants ever measured. It neutralizes reactive oxygen species that oxidize LDL cholesterol. Without oxidized LDL, macrophages are not triggered to form plaque. Reducing LDL oxidation removes the primary driver of plaque formation. Oleuropein restores endothelial nitric oxide production. It activates the enzyme E-NOS, producing nitric oxide that keeps arterial walls healthy. Restored nitric oxide leads to arterial relaxation, lower blood pressure, and reduced platelet aggregation. The endothelium begins functioning properly. Oleic acid, the main fatty acid in olive oil making up roughly 70% of total fat, directly lowers LDL susceptibility to oxidation. LDL particles containing oleic acid resist oxidation far more than LDL with saturated or polyunsaturated fats. The PREDIMED trial, enrolling 7,447 high cardiovascular risk participants, randomized them to a Mediterranean diet supplemented with extra virgin olive oil, a Mediterranean diet with mixed nuts, or a low-fat control diet. The trial was stopped early by the Safety Monitoring Board, not due to harm, but because results overwhelmingly favored the olive oil group, making continuation of the control unethical. The extra virgin olive oil group experienced a 30% reduction in major cardiovascular events, including heart attack, stroke, and cardiovascular death, compared to the low-fat diet group. 30% reduction from just 2 tablespoons of olive oil per day. No statin achieves a 30% reduction in cardiovascular events alone. The most effective statins reduce risk by 20 to 25%. A $2 bottle of extra virgin olive oil outperformed the strongest pharmaceutical intervention in the most rigorous nutritional trial ever. The cardiology industry has spent 50 years ensuring this remains a secondary conversation. The global cardiovascular treatment market generates over $200 billion annually. Statins alone earn over $15 billion each year. Blood pressure medications add tens of billions. Anticoagulants, stenting procedures, bypass surgery, and cardiac rehabilitation complete the market. This market assumes cardiovascular disease requires continuous pharmaceuticals and interventions, not 2 tablespoons a day of a $2 bottle of extra virgin olive oil. The economics of cardiovascular medicine rely on chronicity. A patient diagnosed with high cholesterol at 50 and prescribed statins produces 30 to 40 years of monthly revenue. A patient reversing arterial inflammation, reducing LDL oxidation, and restoring endothelial function with daily olive oil generates no prescription revenue. Statin therapy must be lifelong. Stop statins, and LDL returns to pretreatment levels within weeks. Plaque formation resumes. This is the subscription model of cardiovascular medicine. Extra virgin olive oil permanently alters the biological environment of plaque formation. Its anti-inflammatory, antioxidant, and endothelial restoring effects build over months of daily use. Arteries progressively become less hospitable to plaque. Oleoanthol, hydroxytyrosol, and oleuropein cannot be patented in their natural form. The olive tree has produced these compounds in the Mediterranean for millions of years. Evidence has not disappeared. Over 10,000 peer-reviewed studies on olive oil and cardiovascular health exist. The PREDIMED trial was published in the New England Journal of Medicine, the most prestigious medical journal. Suppression is subtle, framing cardiovascular management around pharmaceutical biomarkers, LDL levels, blood pressure, inflammatory markers, rather than dietary patterns addressing the root biological process. Guidelines suggest discussing diet, then prescribing a statin. Dietary advice recommends reducing saturated fat without specifying that replacing it with extra virgin olive oil dramatically improves outcomes compared to refined carbohydrates or seed oils. There is no 30-second television ad for olive oil alongside statin ads because no one profits enough from $2 bottles to fund a cardiovascular prevention campaign. The $200 billion industry profits from treating consequences, not preventing disease. Knowledge never disappeared. Olive oil is the most studied dietary intervention in cardiovascular medicine history, with over 10,000 peer-reviewed studies. The Predimed trial alone has been cited over 5,000 times since its publication in 2013. A follow-up analysis in 2019 found olive oil participants showed measurable reductions in arterial stiffness, a direct measure of plaque burden. Arteries became more flexible as plaque decreased. A 2020 study in the Journal of the American College of Cardiology analyzed olive oil consumption in over 90,000 Americans over 28 years. Participants who consume more than half a tablespoon of olive oil each day experienced a 14% lower risk of cardiovascular disease and an 18% lower risk of coronary heart disease compared to those who rarely used olive oil. A 2017 study published in Circulation, the flagship journal of the American Heart Association, found that oleoanthol from extra virgin olive oil affected arterial inflammation markers similarly to low-dose aspirin therapy. The American Heart Association recommends low-dose aspirin for cardiovascular prevention, but does not provide a primary recommendation for daily extra virgin olive oil, even though the evidence supporting olive oil is larger, more consistent, and more clinically significant than that for aspirin in primary prevention. Cardiologists practicing integrative medicine who incorporate olive oil protocols report consistent improvements in inflammatory markers, endothelial function scores, and arterial stiffness measurements over 6 to 12 months of daily use. These are the same biomarkers targeted by statin therapy. The difference is that olive oil improves them by addressing the underlying disease process rather than managing a single downstream marker. Step 1. Purchase extra virgin olive oil. The term extra virgin defines a strict production standard. It must be cold pressed without heat or chemical extraction, with free acidity under 0.8%, and must pass sensory evaluation for taste and aroma. These standards preserve oleoanthol, hydroxytyrosol, oleuropein, and other polyphenols responsible for cardiovascular benefits. Refined olive oil, labeled simply as olive oil or pure olive oil, undergoes processing that removes most active compounds. Refined olive oil does not produce the same cardiovascular effects. Look for quality indicators: dark bottle to protect polyphenols from light, harvest date within the last 12 to 18 months, and a peppery or bitter finish, which signals oleoanthol. Mild or completely smooth oils have had active compounds removed or never present in sufficient quantities. A reputable bottle costs between $8 and $20 for 500 milliliters. At 2 tablespoons per day, it lasts roughly 30 to 35 days, making the daily cost approximately 25 to 60 cents. Step 2. Consume 2 tablespoons of extra virgin olive oil daily. This is the dose used in the Predimed trial, which produced a 30% reduction in major cardiovascular events. Do not exceed 4 tablespoons per day. Extra virgin olive oil contains roughly 120 calories per tablespoon. 2 tablespoons add 240 calories, so adjust other dietary fat sources if necessary. Step 3. Consume it raw whenever possible. High heat degrades oleoanthol and other heat-sensitive polyphenols. Use extra virgin olive oil as a finishing oil on completed dishes, in salad dressings, or added to soups after cooking. Low to medium heat cooking is acceptable, such as sautéing or light frying. Temperatures above 200 degrees Celsius significantly reduce polyphenol content. Step 4. Replace other dietary fats with extra virgin olive oil instead of merely adding it. Cardiovascular benefits in Predimed came from participants making olive oil their primary dietary fat. Replace butter on bread, swap seed oils for olive oil in cooking, and use olive oil-based dressings instead of cream-based ones. Displacing saturated animal fats and omega-6 rich seed oils amplifies benefits beyond simple addition. Step 5. Maintain consistent daily use for at least 6 months before evaluating results through blood work. Endothelial restoration, LDL oxidation reduction, and anti-inflammatory effects accumulate over time. Significant improvements in inflammatory markers such as CRP and IL-6 generally appear within 3 to 6 months, while arterial stiffness improvements appear in 6 to 12 months. Track markers like high-sensitivity CRP with your physician if possible. Total daily investment for a cardiovascular protection protocol confirmed in the most rigorous nutritional trial to reduce major cardiovascular events by 30% is approximately 25 to 60 cents per day. Compare this to a standard statin prescription at $100 to $200 per month, which reduces cardiovascular events by 20 to 25% through a single mechanism without addressing endothelial dysfunction, LDL oxidation, or arterial inflammation. A $2 bottle of extra virgin olive oil outperformed it in the largest trial of its kind. Guidelines did not change, but arteries respond to biochemistry, not guidelines. Hippocrates documented this 2,400 years ago. Mediterranean populations have followed it for 4,000 years. The Predimed trial confirmed it in 7,447 participants. Over 10,000 peer-reviewed studies support it. It costs about $2 a bottle. The most common cause of death in developed countries has been addressed by a substance growing on trees in the Mediterranean since before the Roman Empire. Oleoanthol and extra virgin olive oil do not have patent numbers. Hydroxytyrosol does not require a prescription. Endothelial restoration does not generate a billing code. Arterial plaque formation has been reversible for 4,000 years with a substance costing less than $1 per day. What changed is not biochemistry, but the $200 billion industry built on making people believe they need something more expensive. Every statin prescription, stent, and cardiac rehabilitation program manages downstream consequences, while 2 tablespoons of extra virgin olive oil daily addresses the biological source permanently. This is not a conspiracy. It is the arithmetic of an industry profiting from treatment rather than prevention. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.